Hello, my name is Allison Cochran. Today, this recording will propose an evidence-based plan to improve the outcome for patients, and we will also examine how to use remote collaboration to provide benefits, as well as challenges in developing and delivering care to our patients. In the current pandemic that is going on in the world today, remote collaboration is even more important. And it's the safest way to provide care to patients, especially if patients don't feel safe venturing out. According to Barachidi Eltoup, who published on this topic in 2015, begin quotations, collaboration with geographically distant partners may enhance a firm's innovative performance. In practice, however, this may be complicated as personal contacts are more limited, so that effective search and transfer of remote partners' tactic knowledge is frustrated. End quotation. Utilizing remote collaboration throughout the healthcare system will be of assistance in providing evidence-based care, but it can also hinder in a way that physicians and nurses don't get to fully physically be assessing their patients hands-on. I will discuss the patient Caitlin and attempt to provide an evidence-based care plan and outline safe and realistic outcomes for our patient Caitlin. So to start, I would like to provide information about Caitlin and her family. So Caitlin is a 2-year-old patient. Her mom brought her into the Valley City Regional ER for 2 episodes of pneumonia within the last 6 months. So her mother, Janice, told the healthcare team that she had a meconium ileus at birth. And during the assessment of Caitlin, they noticed decreased breath sounds, rhonchi, respirations at 32, shallow with a temperature of 101 degrees. After an aerosol treatment and chest physiotherapy given by the respiratory therapist, Caitlin had thick secretions. Dr. Copeland noticed Caitlin had a weight of 20.7 pounds with some decreased subcutaneous tissue in her extremities. A sweat chloride test was done with a result of 65 milliequivalents, and then a report from her mother that the patient's skin tasted salty after a kiss, and Dr. Copeland then made a final diagnosis of cystic fibrosis, unfortunately. And with this confirmed diagnosis, the treatment plan was beginning to be implemented, and we could actually move forward with treatment. Cystic fibrosis is a complex disease to have for parents to try and conquer this disease far from healthcare facilities is definitely a challenge living in a rural area. So the healthcare staff collaborated to assist Janice and Caitlin using the virtual communication, telehealth. Before leaving the hospital, Dr. Copeland placed Caitlin on the extra calorie diet and with fat-soluble vitamins. So those would be A, D, and K. Now let's explain in which ways evidence-based practice model was used to help develop this care plan for Caitlin. So, telehealth, telemedicine assists in the delivery of treatment to improve patient outcomes by using evidence-based practice and technology in place where doctors and patients are separated by distance. Developing the care plan through telehealth started with Virginia Anderson, the pediatric nurse. She realized the family lived far from the actual healthcare facility and any doctor's offices really in a rural area. And then they virtually contacted Caitlin's pediatrician, Dr. Benjamin, to update him on the condition of his patient and the new diagnosis of CF. And then just to update Dr. Benjamin around the care plan to what the next steps are so everyone's on the same page. They made sure he had access to telemedicine and to the facility, Valley City Regional Hospital. And when he acknowledged that he didn't, they found an alternative route and they utilized Skype. In the article written by George, ETAL, they use online meetings to provide the interactions between team members for the opportunity to review policies, update one another, have discussions related to literature reviews. Through telehealth, Caitlin's healthcare team is able to discuss diagnostics, diagnoses, and any change in condition or treatments that they may encounter. For example, once Janice and Caitlin got home from the hospital, the social worker set up a virtual conference between them and the physicians. Janice utilized this time to just basically ask questions. This is a new diagnosis, so it is the unknown. And then when Caitlin started to not feel so good, Janice did become a little overwhelmed and had questions. So again, she utilized that time to ask questions about the physiotherapy. And then there was another online article. It was called quotations, telehealth use in rural healthcare, end quotations. It speaks on how telehealth can assist the healthcare systems and other organizations as well as providers to expand access and to improve the quality of rural healthcare. Physiotherapy and breathing treatments are imperative in the care for Caitlin since she does have cystic fibrosis, respiratory issue. So being able to contact respiratory therapists and express concern about the patient is possible with a telehealth option. Great improvement. Without close watch and great education, CF patients can decline rapidly. So being able to involve the healthcare team through telehealth is beneficial for patients like Caitlin who live in rural areas and who have serious diagnoses and a new diagnosis at that. It's also good support for the parents because they have a line for any questions they might have if they're doubting or just overwhelmed at all, any treatment questions. Now let's reflect on the evidence that's most relevant and useful when making decisions regarding the healthcare plan. So, the decision to implement telehealth program was essential for Caitlin's care plan, being that her family did have a long commute to the healthcare facility, and it's a new diagnosis it's a complex respiratory disease. Having this complex disease and being over Skype does present difficulties because the patient has to be accessed by someone remotely and then that information funneled to the physician. So it's not, again, hands-on with the patient. So it is explained in a 2015 article by Baricelli, Altote, begin quotations. He spoke about the difficulty in finding good collaboration partners is beneficial to effectively transfer and exploit their knowledge. With the team trusting each other, this will increase the lifespan for Caitlin and ease her family's worries, end quotation. Lastly, I'm going to identify benefits and strategies to mitigate the challenges of interdisciplinary collaboration to plan care within the context of a remote team. So telehealth was introduced to Caitlin and her family due to the long commute, and they also, it takes a long time for them to get to the medical facility, and she has a severe condition again. So also, both of her parents work really long hours, and they're not able to just call in sick at a whim, and they kind of rely on their money to get by, to support their family. So they don't have the ability to just take off for appointments, especially if something in the condition changed rapidly. Therefore, implementing the remote collaboration would mitigate the challenges for the family and stress, and incorporate the team that built Caitlin's plan of care so everyone's on the same page. Implementing this will reduce the times that her parents have to take off work, but will still guarantee that Caitlin gets the medical attention that she needs with her diagnosis. So everyone should have the ability to access healthcare, and utilizing remote collaboration makes that opportunity greater. It lessens the gap. Quoted from the online article, begin quotation, telehealth use in rural healthcare, end quotation. Telehealth allows specialists and subspecialists to visit rural patients virtually, improving access as well as making a wider range of healthcare services available to rural communities via telemedicine. In the article composed by Dewan and Chermile Music, they correlate the remote team's communication and they leverage the strengths, and they actually gain the advantage over co-located teams. As a nurse, but mostly important, a patient advocate, it is important for me to understand the significance of this remote collaboration and how it can best be utilized for the better patient outcomes, as well as people like Caitlin that may not have access to all of the in-person and not rural areas. Thank you for your time. Thank you for listening to my presentation. Good night.